Hi guys, my name's Juanita Ismalka, and today I'm going to be doing my final presentation, the subject being mental illness among Alaska Natives. So what is mental health? Mental health is an all-encompassing idea. It affects how we feel, think, and act. Throughout a person's life, mental health is of the utmost importance, and for certain groups, mental health is unfortunately neglected. American Indian and Alaska Native people have alarmingly high rates of mental health issues. More than half of Native American adolescents report being depressed. Overall, American Indians and Alaska Natives experience serious psychological distress 1.5 times more than the general population, as stated by the American Psychiatric Association. These statistics show that there is a serious problem at hand that needs to be solved to better treat American Indian Alaska Native populations. I intend to give a thorough look into the mental health issues impacting Alaska Native people, including the causes, its effects, and possible solutions. Poverty is a large issue for many American Indian and Alaska Native people, with more than 1/4 of their overall population living in poverty, a rate that is more than double that of the general population, and one that is even greater for certain tribal groups, which approaches 40%. American Indian, Alaska Native families with children also have an increased likelihood of living in poverty. Gender-based trauma is a large issue affecting American Indian and Alaska Native women, which in turn can cause many mental health issues. Study findings on lifetime exposure to interpersonal violence among urban American Indian, Alaska Native women were alarming. More than half, 65.5% of women in the sample had experienced at least one serious form of traumatic interpersonal violence, with the largest percentage reporting some form of sexual assault in their lifetime. With these rates of trauma, it is easy to see how so many American Indian and Alaska Native women fall prey to mental illness and substance abuse in their lives, and it also affects those around them. Historical trauma is a huge issue among these people, and it still affects the mental health of many today. While there are those today who are not personally affected by certain transgressions against Native people, it still did touch them in a negative manner. These traumas were compounded intergenerationally and were experienced at an individual as well as a collective level. Ancestors who were assimilated did not go on to parent the way they were meant to. Instead of cultural heritage, a lot of what was passed on was self-anger and problems expressing oneself in a non-confrontational manner. Many American Indian and Alaska Native people are still reeling from issues stemming from historical wrongdoings, but they are largely ignored or told to get over it instead of being taught how to actually cope. Lack of access to health care is a large barrier for American Indian and Alaska Native people when it comes to mental health. One survey found that 33% of American Indians and Alaska Natives lack health insurance, and this leads them to Indian Health Services, which provides care to members of federally recognized tribes across the United States. A Commission on Civil Rights reported documents that the Indian Health Services is so severely underfunded that it spends just $1,914 per patient per year, compared with twice that amount, $3,803, that is spent on a federal prisoner per year. The fact that more money is spent on the care of federal prisoners rather than the care of the United States indigenous population shows just how poor the state of affairs is between the two. Mental health services are 1/3 the demand for services from IHS. And despite such a demand, only 7% of an already limited IHS budget is allocated for mental health and substance abuse services. The effect of this underfunding and availability of mental health services is dramatic. By one estimate, there were only 2 psychiatrists and 4 psychologists per 100,000 people served by IHS. 1/7 the number of psychiatrists and 1/6 the number of psychologists available to the general population. With funding shortcomings, we can definitely see why so many people go untreated for long periods of time. When Indian Health Services is the only option for mental health care, people suffer unduly for years before getting help. As a result of the limitations in the growth of funding for Indian mental health programs, for a number of years there has been no general IHS or tribal national meetings dedicated to the sharing of technical and clinical information. Lack of data collection on mental illness rates by Indian Health Services contributes to the overall lack of resources and direction for the treatment of American Indian Alaska Native patients. Past poor relationships with governmental agencies is also a barrier to effective mental health care. Given the history of this ethnic group's relationships with the U.S. government, many American Indian and Alaska Native people may not trust institutional sources of care and may be unwilling to seek help from them. Telling American Indian and Alaska Native people they should seek help from the government isn't quite as simple as it should be. Much of the mistrust doesn't go that far back into history, and many are still hurting. The lack of help available for mental health issues can also be seen as a governmental injustice against Native peoples. And going to IHS does feel largely like a government program, affixing band-aids to severe problems, both physical and mental health. Cultural norms in communication amongst American Indian and Alaska Native people have a negative effect on how new methods of mental health treatment. If an assigned role does not follow established social patterns and is not aligned with that person's role in the community and family life, it is unlikely that she or he will be able to do the job. In this way, creating a new job or funding a village program is unlikely to achieve its purpose if it does not fit into the already placed social systems and cultural practices of a community. For example, women might have a hard time providing effective services to men in the community, or vice versa, if a relationship was already established before the medical relationship took place. Clinicians also may be more likely to ignore symptoms that American Indians deem important, or less likely to understand the American Indians' fears, concerns, and needs. Native people may see the physical symptoms of depression as more prominent, and the clinician thus does nothing for them, because the physical symptoms appear to have no cause. The Surgeon General's report provides extensive documentation showing that racial and ethnic minorities in the United States are less likely than whites to seek mental health treatment, accounting for the underrepresentation in most mental health services. Like many other minority groups, American Indian and Alaska Native people do not like to willingly admit mental health issues, as it can be seen as a weakness or a personal flaw. This, of course, is not a healthy view to be taken when rates of mental illness and substance abuse are so high. Lack of representation in the mental health field by American Indian or Alaska Native people is another point that has a negative effect on mental health services. Approximately 101 American Indian and Alaska Native mental health providers, which includes psychiatrists, psychologists, social workers, psychiatric nurses, and counselors, are available per 100,000 members of this ethnic group. This compares with 173 per 100,000 for whites. There are cultural barriers that occur between patients and their doctors simply because of a lack of understanding about one another. It can be more reassuring for an American Indian or Alaska Native patient to open up to another Native person, whereas they might not feel as comfortable with a non-Native provider. Substance abuse is a prevalent problem amongst American Indian and Alaska Native people and is largely influenced by the high rates of mental health issues. Among American Indians, high rates of psychiatric problems and related comorbidity with substance abuse have been reported, with estimates of 20 to 63% among adults. There is a clear relationship between substance abuse and mental illness, one that may cause a clinician to focus on the presenting problem of substance abuse rather than the underlying mental illness as exacerbating the problem. Suicide is a serious problem among American Indian and Alaska Native people and is a direct result of poor mental health condition. The suicide rate of 15 to 24-year-olds is 2.8 times higher than non-Native youth in the same age range. Suicide is the ultimate sign that something is wrong, and the fact that so many choose to end their lives shows that they feel both helpless and hopeless. And this obviously has a continuing cycle of poor mental health. The more people don't get treated, the more they just pass it on to the next generation. Tailored mental health services would have a positive effect on the mental health of American Indian and Alaska Native peoples. Native people have a unique culture and a way of life that is rich and integral to feeling of being whole. When this uniqueness is ignored in favor of seemingly culture-free professional practices, they may feel as though they're being ignored. By acknowledging their cultural heritage and even involving it in their mental health treatment, the patient would feel more comfortable. Culture is such a large part of who Native people perceive themselves to be that without acknowledgement, it might seem that they're being ignored. Spiritual and cultural immersion is another factor that shows a positive influence on the mental health of American Indian and Alaska Native people. For American Indians, spiritual coping and immersion in traditional health practices exert intrinsic health benefits that may reduce substance use and improve other health-related outcomes. Substance abuse seems to be very, very vulnerable to spirituality and religion, as shown by the many 12-step programs which rely heavily on patients giving up control to a higher power. Support is the most feasible solution to mental health problems amongst American Indian Alaska Native people. It's free and easily accessible. The company of others doesn't necessarily mean that the person has to confront issues they aren't comfortable with. Talking of the Yupik people, if someone was sad or depressed, invitations would be offered to travel. Special jokes would be told to highlight a happy memory. Or friends would just come by for a visit, not because their problem had been identified, but because being there for each other in ways that highlight personal connection is important. Creating a social support network is doable for most everyone and works wonders on helping those with mental health issues that may not feel comfortable in a clinical setting. Mental illness is universally a big deal. But for American Indian and Alaska Native people, it's a problem that has largely been ignored and unresolved. More needs to be done to help Native people. Solving these issues would benefit them as a whole, as even non-sufferers are affected by those around them. Only time will tell if mental health issues among Native people will be taken seriously and addressed by those who are supposed to be helping them, or if they will just be left to go untreated. I have a positive outlook on this. It seems more and more attention is going to the mental health of Alaska Native people, and I have high hopes for the future. Thank you for listening to my presentation, guys. I've appreciated it. I've enjoyed this class this semester, and I'm just glad to be done. So here are my references that I used, and thank you.